I'm Dr. Frita. I'm a board certified kidney doctor, and today I'm giving you 5 kidney failure warning signs and symptoms that show up at night. And number 3 wakes most people up out of their sleep. If you've been waking up multiple times at night and you just can't seem to figure out why, don't blame it just on bad sleep. Your kidneys might be trying to tell you something. Healthy kidneys should be following your body's internal clock. So at nighttime, your kidneys should be concentrating your urine so that you have restful sleep and you're not getting up all times of night to keep running to the restroom. While you sleep, your kidneys regulate your fluid, your body's electrolytes, your body's minerals, and they act accordingly as your circulation slows. If your kidney function starts to decline, if your kidneys are starting to get worse, then oftentimes these nighttime processes are among the first to break down. As a kidney doctor, I can tell you that for many of my patients, the first time that they learn that they have serious kidney disease is not just from a routine doctor's visit. Oftentimes, their kidneys give them the first warning sign at 2 a.m. in the morning. If you've been having trouble sleeping, you might be automatically blaming it on stress or aging or just having poor sleeping habits. And yes, these issues really could contribute to having bad sleep. But guess what? Nighttime is that window where poor kidney function often presents itself for the first time, and many people miss it. Well, I don't want you to miss it. So today, I'm walking you through 5 kidney failure warning signs and symptoms that show up specifically at night. Keep watching. Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. I'm Dr. Frita, and because I am a board certified kidney doctor, I'm talking to you about what I know and what I see in my patients. So please be sure to go ahead and give this video a like, give us a subscribe, and be sure to hit the notification bell so that you'll be among the first to know when I share other evidence-based videos. Let's go ahead and get started. Here are 5 kidney disease warning signs and symptoms that show up specifically at night. Number 1, nocturia, or waking up multiple times at night to urinate. Healthy kidneys concentrate urine at night so that you can have a restful sleep. Well, if your kidney function starts to decline, then you may lose that ability to concentrate your urine, which results in a more dilute urine, and that can cause you to wake up multiple times at night to use the restroom. If you're getting up maybe once at night, perhaps twice, then that could be normal for you. But if you start getting up 2, 3, 4, 5 times at night, and this becomes a regular routine and it's an increase from what your norm is, well, that's nocturia, and it deserves to be looked at very carefully. Oftentimes, nocturia is one of the earliest warning signs of kidney disease, and it can show up in patients years before they get an official CKD diagnosis, chronic kidney disease. So here's what I want you to do. I want you to track how many times at night you're getting up to use the restroom. Go ahead, put it in your calendar, and for at least a week, just mark how many times you're getting up at night. If you find that you're having an increased amount of times that you're getting up, I want you to share it with your doctor. Now, there are things other than just kidney disease that can cause nocturia. For example, if you have diabetes or high blood sugar, that can do it. An enlarged prostate, bladder dysfunction, even urinary tract infections, all of those things are possible. But if you're having nocturia, and if you don't have a clear explanation as to why you're having it, then it's certainly worth talking to your doctor and finding out if it's a warning sign of kidney disease. Has anyone ever told you that waking up multiple times at night is just part of getting older? Drop a comment if you've heard that one before. Restless leg syndrome. Do you have legs that just give you the urge to move, especially at night, almost always at night? Do you ever get like this kind of a tingling, uncomfortable sensation in your legs at night that can only be relieved if you move your legs? If you answered yes, then you might have restless leg syndrome, and it could be connected to kidney disease. When you have CKD or chronic kidney disease, then that means that your kidneys are not filtering out toxins the way that they should. Also, your kidneys are typically not making enough erythropoietin, which is a substance that's necessary in order to help to prevent anemia. And so, as a result, patients with CKD have kidneys that don't filter out toxins the way that they should. And this can lead to a buildup of toxins or even uremia. Also, patients with advanced CKD don't make erythropoietin, or the substance that helps to prevent anemia, in the amount that they should make it, and it leads to them oftentimes having anemia. These issues can be triggers for restless leg syndrome. Be sure to click the link in my description or visit me on my one-stop shop, dr.frita.com, because I have a freebie for you. I have a PDF, 10 Healthy Habits for a Better You and a Better Life. These are just some of my everyday lifestyle habits that I use in order to live my healthiest, happiest life. Research shows that restless leg syndrome affects up to 30% of patients with CKD, compared to just 10% of patients in the general population. And oftentimes, when patients have restless leg syndrome, they're just told to exercise more, or they're just given sleep medication without ever actually having their kidney function explored. So if you're experiencing restless leg syndrome, especially if it's affecting the way that you sleep, please contact your doctor and ask for your kidneys to be evaluated. Ask for a basic metabolic panel, BMP, and for your doctor to evaluate your BUN, your creatinine, and your EGFR, estimated glomerular filtration rate. Now, this next symptom is one that wakes my patients straight up out of their sleep. Number 3, severe nighttime cramps. Now, I'm not talking about just run-of-the-mill cramps that you get and kind of walk off and you're doing okay. No, I'm talking about severe cramps that show up at night that will cause my patients to jolt right up out of their sleep. These cramps typically occur in the calves or even the feet, and they can last for minutes and they can leave you sore for hours. So here's the kidney connection. Your kidneys are responsible for helping to maintain electrolyte and mineral balance in your body. They help to regulate your balance of calcium, magnesium, phosphorus, potassium. Well, if you have kidney disease or CKD, then oftentimes these electrolytes are out of whack. And when these electrolytes are not in proper balance, it can lead to muscle hyperexcitability, which can lead to cramps. At nighttime, when the circulation slows down, this is when these cramps will often show up in abundance. For my patients who are already on dialysis, well, oh my gosh, I see this quite a bit in the clinics, because when we're dialyzing patients, it causes these shifts in fluid, shifts in electrolytes, and honest to goodness, it can make my patients cry, those severe cramps. But what a lot of people don't know is that severe nighttime cramps can actually show up way before dialysis even becomes a part of the conversation for CKD. It's important that you understand this so that if you are experiencing severe nighttime cramps and you don't have a clear answer, please, you want to be sure to bring it up to your doctor to make sure that your kidney function is evaluated. Most people already know that you can get leg cramps from exercise, overexertion, if you're having heavy sweating. They know that, but many people don't realize that severe leg cramps can be a warning sign of kidney disease. Well, if you don't know, now you know. And so if you're having severe nighttime cramps, contact your doctor, because it could be a warning sign of kidney disease. Be sure to watch my video on 7 toxic signs of kidney failure hiding in your feet after you finish watching this video. Number 4, intense itching or uremic pruritus. Now, this is a kidney disease symptom that's often overlooked because people think that if they have itching in the skin, that it's something dermatologic. And so my patients will spend years going to see dermatologists or trying creams or changing their detergents, when truly the issue could be the kidneys. Here's what happens. If you have advanced kidney disease and your kidneys aren't filtering properly, this could lead to a buildup of uremic toxins and a buildup of phosphorus. Your kidneys are responsible for filtering out excess phosphorus. And so if you have advanced kidney disease and that phosphorus builds up, then the phosphorus and the uremic toxins can actually irritate your nerve endings, causing a severe, intense itching. I can tell you firsthand that when my kidney disease patients experience this itching, it is just about unbearable. They will sit there and just claw and scratch and leave scratch marks in their skin, and they just cannot get rid of the itching. Oftentimes, my patients will go to their primary care doctors or they will see their dermatologist, and they wonder why, even if they've been giving medications and antihistamines and all kinds of creams, it just doesn't seem to fix the problem. That's because the problem is not coming from the outside of the skin, it's coming from inside of the body, from the kidneys. The call is coming from inside the house. If you have intense itching and it's from uremic pruritus, it's due to your kidneys not functioning well. And again, this is usually with advanced kidney disease like CKD4, CKD5, my patients who are on dialysis. The reason this symptom will oftentimes show up at night more intensely is because, one, when you're sleeping or at least trying to sleep, you're less distracted and you can really notice when you're itching. Also, your body's core temperature tends to drop a little bit at night, and that can sometimes intensify the irritability of the nerves that cause this intense itching. Here's what I want you to do, and I want you to do this right now with me. Take a look at your skin, okay? I'm serious. Give yourself a nice little once over. Do you have any scratch marks, like or any dark hyperpigmented marks where you've been kind of chronically scratching your skin? Have you gotten used to it to the point where you almost don't notice it? Well, if you answer yes, then I want you to contact your doctor and just ask. Say, what is my kidney function? Ask your doctor your BUN, your creatinine, your EGFR. And if you have CKD, especially if it is CKD3 or more advanced, then I want you to ask to be referred to a kidney doctor. Also, I want you to ask what your phosphorus level is. If your phosphorus level is high, if it's elevated, then that could be contributing to your itching. If so, there are things that your primary care doctor can suggest to help to lower your phosphorus, such as decreasing phosphorus in your diet, or even suggesting certain medications that can lower the phosphorus, especially if you have advanced kidney disease. Yes, there are many different possible causes of intense skin itching, such as dermatologic diagnoses like eczema. Also, you could be having some type of an allergic reaction to your detergent, to your lotions, but also a major cause of intense itching could be kidney disease, and that's one you do not want to miss. Be sure to watch my video on CKD stages explained after you finish watching this video. Number 5, nighttime nausea or nausea upon waking. Now, this one is a symptom that often gets overlooked, but it's really important because it really could be a warning symptom of CKD. Question: what is the one symptom on this list you wish someone would have told you about sooner? When you have advanced chronic kidney disease and your kidneys aren't filtering out those kidney toxins as the way that they should, then you can get a buildup of kidney toxins or uremic toxins. And these uremic toxins can actually be irritating to your stomach. Oftentimes, this symptom is more prominent at night when you're lying down. Now, it's easy to dismiss because a lot of people will think, well, maybe it's just something I ate, or maybe I'm having a little heartburn, okay, a little gastroesophageal reflux disease, GERD. There are a million things that can cause nausea, right? But one you don't want to miss is kidney disease. And here's the connection. Your vagus nerve is a nerve that helps to innervate your digestive system, okay? Your vagus nerve runs through your digestive tract. So if you have a buildup of those kidney toxins that you're not filtering properly because of your kidney disease, well, those toxins can actually irritate the vagus nerve, and this can lead to nausea or, in some cases, even vomiting. And yes, this nausea is oftentimes very prominent at night, but in some patients with kidney disease, the nausea can be really bad first thing in the morning. And so if you're someone who's having nausea at night or nausea first thing in the morning and you're noticing a pattern and you don't have a clear explanation, make sure you consult with your doctor to find out if your nausea at night is due to kidney disease. Do any of these symptoms sound familiar? If you've been experiencing any of them, be it the nocturia, restless leg syndrome, intense cramps at night, uremic pruritus, nighttime nausea. If these sound familiar, I want you to contact your doctor this week. Not next month, not after your vacation, not after the holiday. I want you to do it right away because it's important that you make sure that these are not warning signs and symptoms of kidney disease in you. Remember that what I share with you is informational. It does not replace the advice of your physician, and it is not intended to diagnose you. Again, I am a board certified kidney doctor, and I'm talking to you about what I see in my kidney patients from week to week. If you found the information in this video to be helpful and informative, please be sure to like this video, and very importantly, share this video with someone you care about. I appreciate your support. I definitely appreciate you for watching, and I want you to do your best to live your healthiest, happiest life. Don't forget, please be sure to give this video a like and click that notification bell. And I'll see you in the next video. I'm Dr. Frita.